Okay guys, very good evening. As I promised you that today we will have a YouTube session. The topic will be DSM-5 updates. So what currently in psychiatry we have a in DSM also we have a DSM-5, in ICD we have a ICD 11. So we have current what are the new updates in DSM-5 that I am going to discuss. It's a very important area, so whatever queries you have, you please ask, and by that time we will go the topic wise and I will give you the new updates in DSM-5. If first we'll talk about schizophrenia. So in schizophrenia there are few important updates. Number one, we have no subtypes in schizophrenia. So schizophrenia and other psychotic spectrum disorder, there is no subtypes. Before we had a paranoid schizophrenia, we had catatonic schizophrenia, we had a hebephrenic schizophrenia, we had a undifferentiated. These schizophrenia we had a subtypes. Currently the current data suggests that we don't have a sufficient data to so reliability and validity is not there. We don't have sufficient data to support the various subtypes of schizophrenia. So now in DSM-5 schizophrenia is schizophrenia, it is not, there is no subtypes. Okay, number two, so this is the first point. Number two, the bizarre delusion word has been removed. We don't use the word bizarre delusion or non-bizarre delusion. Delusion is delusion. Okay, so there is no bizarre delusion. This bizarre delusion word we don't use in DSM-5. Also in first rank symptoms, this auditory hallucination, we were giving the importance to first rank symptom auditory hallucination in making a diagnosis of schizophrenia. This importance we are not giving now. So we remove two important, there is no, the bizarre delusion concept is not there in DSM-5, and the first rank symptom auditory hallucination, we were using third person hallucination, commenting type, third person hallucination, discussing type, that we are not using now. This importance has been removed from the diagnosis. Okay, apart from that, we were making a diagnosis of delusional disorder and still we are making a diagnosis of delusional disorder. We were calling it a persistent delusional disorder, we call it a delusional disorder. In DSM-5, for making a diagnosis of delusional disorder, we were using the one criteria that one non-bizarre delusion. This non-bizarre word also we have been not using now. Now delusion is delusion, it is not bizarre or non-bizarre. Okay, so it's a delusion is delusion, so non-bizarre delusion has been removed. Okay guys, apart from that, we had a schizoaffective disorder. This schizoaffective disorder we had in DSM-4 also, and currently we have in DSM-5 also. Schizoaffective disorder, before till DSM-4 we were saying that patient having a schizophrenia, suppose patient having since 2 years, patient having a since 2 years patient having a schizophrenia. In these 2 years, a patient once fulfilling the criteria of mania or depression, once the patient fulfilling the criteria of depression or mania, we were making a diagnosis of schizoaffective disorder. Now, so it was till DSM-4. Now DSM-5, we say that suppose patient having a schizophrenia since 2 years, so this, to call it a schizoaffective disorder, this manic symptom also should be, or depressive symptom should be, if not 2 years, they should last almost for 2 years. If not 2 years, they should last at least for 2 years. So what I am trying to say, that in schizoaffective disorder, before we were making this diagnosis cross sectional, that once we have any manic or depressive episode, we could call it a schizoaffective. Now we say no, this is not, we can't call it a schizoaffective disorder. DSM-5 says to call it a schizoaffective, this depressive symptom or manic symptom, basically the affective symptom, should be almost the same duration like a schizophrenia symptom. So now we say that schizoaffective disorder is longitudinal. It is not cross-sectional. It is not cross-sectional. We can't make a diagnosis of schizoaffective disorder cross-sectionally. We have to make a diagnosis of schizoaffective disorder longitudinally. That we are saying for particular time we have a schizophrenia symptom, thus almost similar time the affective symptoms also should last. Okay guys, so these are the changes in schizophrenia and other psychotic spectrum disorder, that there is no subtypes of we have of schizophrenia. Now schizophrenia is schizophrenia. Number 2, we removed the bizarre delusion word, the first rank symptom. We are saying auditory hallucination, we are not giving importance. In delusional disorder, this criteria also has been removed. Non-bizarre delusion, we are using the word delusion. And schizoaffective disorder is diagnosis is longitudinal rather than cross-sectional. Okay. Second, we have dementia. Now we call it we have a neurocognitive disorder. So we divide neurocognitive disorder, that major neurocognitive disorder and minor neurocognitive disorder. To call it in major, we have a dementia. Minor, or we say the mild neurocognitive disorder. In major, we have a dementia plus amnestic syndrome. And in mild, we have a symptoms of cognitive deficit, but they are not able to fulfill the criteria of dementia and amnestic syndrome. We call it a mild neurocognitive disorder. So this we have divided the major and minor or mild neurocognitive disorder in dementia. Okay. In mood disorders, in depression, we having a new category of disruptive mood dysregulation disorder. So we have a new category of disruptive mood dysregulation disorder. In this we have they have anger outburst, irritability, which is out of proportion to the given situation. it should be 3 times per week. Age of the child should be more than 6 years and less than 18 years. Okay, more than 6 and less than 18, and it should be 2 out of 3 settings. Okay, this setting is home, school, and among peer groups. And intermittently also child remain irritable. Intermittently also child remain irritable. This is disruptive mood dysregulation disorder. Okay, yeah. Another new diagnostic entity we have used in DSM-5 is premenstrual dysphoric disorder. Premenstrual dysphoric disorder. Premenstrual dysphoric disorder. Okay, premenstrual dysphoric disorder. In female, in OPD over the years, it has been seen that they are having a specific mood symptoms during the menstrual cycle. So we are making this premenstrual dysphoric disorder last week pre-menses and after few days after onset of it. So during last week pre-menses and few days after onset of menses, they having these mood symptom, we call it a premenstrual dysphoric disorder. Okay, these are 2 new criteria has been added in mood disorder. Apart from that, in bipolar disorder also this otherwise is specified, and other we have included. They are at least this you have to remember for MCQ purpose. In the third, in substance use disorders, addiction psychiatry. The new word has been used in DSM-5, addiction psychiatry. Addiction psychiatry or substance use disorder. Addiction psychiatry or substance use disorder, what has been used in DSM-5? Number 1, what are the update? Gambling disorder. Gambling disorder. Gambling disorder has been included as a diagnosis entity in the addiction psychiatry. जुआ खेलना gambling disorder is a now disorder, gambling disorder. Okay, apart from that we have a cannabis and caffeine withdrawal symptoms. Cannabis and caffeine. So before we were not having a any cannabis withdrawal symptom and caffeine withdrawal symptom we were not including in the as a withdrawal criteria, but in DSM-5 cannabis and caffeine withdrawal symptom has been included as a criteria. Okay, as a criteria. So gambling disorder and cannabis and caffeine withdrawal symptom has been included as a criteria. Okay. Before we were saying substance dependence and the substance abuse, but in DSM-5 now we use the word substance use disorders. Substance use disorders. In substance use disorder, together we use for the substance abuse and substance dependence. substance abuse and substance dependence. Current we use the word substance use disorder. So caffeine and cannabis withdrawal symptoms criteria has been included in DSM-5. Gambling disorder first time included in DSM-5. And substance use disorder, we club together substance abuse and substance dependence, and we use the word substance use disorder. With withdrawal criteria, substance use disorder with intoxication criteria. That's how we are making, or substance use disorder due with the general medical condition like this. We are making these diagnoses. Okay, this is about the substance use disorder in DSM-5. If we will go further in anxiety disorder, disorders, before OCD, obsessive compulsive disorder, and post-traumatic stress disorder, we were counting under the anxiety disorder. Now they are no more under anxiety disorder. For OCD, we have a separate category, obsessive compulsive and related disorder. Obsessive compulsive and related disorders. Obsessive compulsive and related disorder, we have OCD, obsessive compulsive disorder. We have hoarding disorder, which has been included as a new diagnostic entity. Number 3, we have a body dysmorphic disorder. We have a olfactory reference syndrome. This you have to remember. I have just told you, but this olfactory reference syndrome we have in ICD-11 olfactory. So but we have under obsessive compulsive and related disorder, OCD, hoarding disorder, body dysmorphic disorder, olfactory reference syndrome, and we have trichotillomania and excoriation, skin picking. Okay, these are the repetitive habit, this related disorder. Trichotillomania, excoriation. Trichotillomania, hair pulling. Excoriation is what? Skin picking. Okay. Hoarding disorder, this MCQ they ask, it has a poor prognosis because we don't have exposure and response prevention therapy is not useful for the hoarding disorder. Okay, so this is the obsessive compulsive and related disorder, new diagnostic entity in DSM-5. Also we have another new diagnostic entity in DSM-5 is trauma and stress related disorder. Trauma and stress related disorders. Trauma and stress related disorders. In this, guys, we have PTSD, post traumatic stress disorder. We have acute stress disorder. Okay, so post traumatic stress disorder, acute stress disorder, and we have adjustment disorder. So post traumatic stress related disorder, trauma and stress related disorder, PTSD, acute stress disorder, adjustment disorder. Okay, adjustment disorder before we had in under mood disorder, but now we have under trauma and stress related disorder. PTSD, we make a diagnosis 6 months or more, and acute stress disorder, we call it a If we have a PTSD within 1 month, we call it a acute stress disorder and adjustment disorder. Previously we had under the umbrella of mood disorder. Now we have under the trauma and stress related disorder. So obsessive compulsive and related disorder, trauma and stress related disorder, these are two new diagnostic entity. Before we were counting them under anxiety disorder. Now we have a separate diagnostic entity. Okay guys. Next is, if you will see in the one thing in mood disorder, just please remember, I am just writing here this important point we have to discuss. Dysthymia in DSM-5, now we call it a persistent depressive disorder. Persistent depressive disorder. So the new term for for dysthymia in DSM-5 is persistent depressive disorder. Okay. So the chronic major depressive disorder and dysthymia we count under the umbrella of persistent depressive disorder in DSM-5. This is from the mood disorder, guys. Okay. Next, before we had somatoform disorder, now we have in DSM-5 we call it a somatic symptoms and related disorders. Somatic symptom and related disorder. So before we were counting it as somatoform, so now this somatoform disorder, this somatization disorder, the somatoform pain disorder, we clubbed together and we using this new diagnostic entity in DSM-5, somatic symptoms and related disorder. Somatic symptoms and related disorder. Okay guys. In DSM-5 regarding dissociative disorder, one important update that before we are saying that we have various subtypes of dissociative disorder: dissociative amnesia, dissociative fugue, dissociative identity or personality disorder, and the trance and possession disorder. Now this dissociative fugue, FUGUE, this has been removed. This category has been removed in DSM-5 and we use dissociative fugue as a specifier in dissociative amnesia. So we use dissociative fugue as a specifier. So before we had a separate category of dissociative fugue, this has been removed because these cases are very rare, and now we are using dissociative amnesia. Under dissociative amnesia we use dissociative fugue as a specifier. Okay, that you should know. Before we were calling another diagnosis, we had hypochondriasis. Now we use illness anxiety disorder. Illness anxiety disorder. Okay guys, illness anxiety disorder in DSM-5. So we were calling it a hypochondriasis. Now we call it a illness anxiety disorder. Illness anxiety disorder. Okay, it's a very important update. In child psychiatry, In child psychiatry we have, before we were calling mental retardation, now we call it a intellectual disability. We call it a, in DSM-5 we call it a intellectual disability. Intellectual disability. Okay, intellectual disability. In ADHD, attention deficit hyperactivity disorder, before we had a criteria, one of the age criteria, we used to make a diagnosis of ADHD before 7 years of age, but now it is before 12 years of age, in DSM-5. So before we were saying that before 7 years of age, now we say before 12 years of age. Okay guys, this is a change in ADHD. Before we were calling pervasive developmental disorder, in DSM-5 we call it a autistic spectrum disorder. So before we were calling it a pervasive developmental disorder, now we call it a autistic spectrum disorder. So this the autism, the Asperger's syndrome, the Rett's syndrome, the Heller's syndrome, we club together under autistic spectrum disorder, and DSM-5 says that we have this spectrum on a severity basis, in continuum. It is continuum rather subtypes. So before we had a various subtypes of the pervasive developmental disorder, autism, Asperger, Rett, everything was separate subtype. Now in DSM-5 it is not subtype, it is in a continuum, it is in a spectrum on a severity basis. Okay guys, I hope it is clear to you. Okay, it's a very important update about child psychiatry. Okay, in eating disorder, in the anorexia nervosa, the 3 months history of amenorrhea criteria has been removed. This 3 months criteria has been removed. This 3 months criteria has been removed. Okay, in now we have this criteria has been removed. We don't use this as a core criteria. Okay, and in binge eating disorder also we brought a new diagnostic entity, which is a basically most common type of eating disorder. So anorexia nervosa, 3 months history of amenorrhea criteria has been removed, and binge eating disorder we brought a new diagnostic entity in DSM-5, which is a most common type of disorder. most common type of eating disorder. Okay, in psychosexual disorder, the sexual aversion disorder has been removed. This category, aversion disorder, has been removed. Okay, and we brought one new category in DSM-5 in psychosexual disorder. We have Genito, pelvic pain or penetration disorder. Genito, pelvic pain or penetration disorder. In this we have this, dyspareunia and vaginismus we clubbed together. Vaginismus and dyspareunia we clubbed together, and we have a new diagnostic entity. We call it a genito-pelvic pain or penetration disorder. Okay guys, and one more thing in autism, while I was talking about autistic spectrum disorder, in autism before we had three important criteria: the language and communication disturbance, the impairment in social interaction, and stereotype behavior. Now we have removed this language and communication disturbance. This criteria has been removed. Now we have only two core criteria: impairment in social interaction and stereotype behavior. Okay guys, so I hope you enjoyed it. Okay, this session, this is a total schizophrenia, dementia, mood disorders, the anxiety disorders, the addiction psychiatry, somatoform, dissociative, child psychiatry, the core important things I have told you in this session. It's a small session, so I hope you enjoyed it. Almost everything I have told you. Some or other thing we can discuss in our future upcoming sessions. So I hope you enjoyed it. Like this and just go through it. It's for any exam, this update will be very useful. Okay guys, so that's why I thought I will bring this YouTube session for you. Okay, so study hard, enjoy hard, and remain mentally and physically fit. Okay, best of luck. Bye bye, good night guys.